Today I'm talking about 3 big reasons why patients leave you, and it has nothing to do with their motivation or their compliance. It actually has to do with you. And if you want to learn more, tune into this episode. Hi everyone, welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. Before we go on to today's episode, what is new, what is better in life? A couple good updates for those who've been following for a while. My son Zach has been asking me for months, hey dad, I've been going to jiu-jitsu enough. You did tell me a year. I promised him that if he stuck to this for a year, that I would allow him to move on to a different sport. That's how it works in our household. It has to be filled with another time slot with more activity. So that it's been a full year. So all of my kids are outside of jiu-jitsu now. Now they're on to flag football and soccer and gymnastics. So that's been great. My son Jacob is almost there. He's trying to beat that record to the fastest to potty train in our family. We're still about a month out from our Disney cruise, which is amazing. I'm excited to do that. We'll be in the Caribbean, which will be fantastic. Personally wise, my fitness is stable. It is consistent. I don't want to change anything. I love where I'm at. My back is feeling better, so I'm ready to go on. For those who follow me on Instagram, at chrisgarcia.dpt. There's a special launch that I'll be doing in the next few days, so pay attention to my Instagram. For those who are learning more and more about regenerative medicine, I'm launching something new for physical therapists and patients, so follow online for that. And then I have my Cash PT Clinical Elevation course coming up in October, so for those who are still interested, there are seats available. I'd love to see you inside that course. All right. Why are we talking about this podcast? Well, it's one of the biggest frustrations that I hear from physical therapists, especially cash PTs. Now, insurance-based PTs is a different world, different problem. For cash PTs, I hear this often, right? I ask people, how's your schedule? And they're like, oh, it's empty right now. I just haven't had a good batch of patients. Well, there was good patients and they just keep leaving, or I got them better and so they're not coming back. And so now that cash PT has this empty schedule. And I was talking to somebody recently in my mentoring groups, and I said, what's the biggest reason why people leave you? And some people were stumped. They're like, I don't know. Actually, that's a good reason, a good question. And in most PTs will attribute it to 2 things usually. It's the patient's fault. They're just not motivated to get better. For that reason, they're not coming back. Or they're not compliant with their home program, and that's why they're not getting their outcomes, and that's why they leave, because they didn't get the outcomes that they wanted. That's fantastic. I understand what you're saying. Those 2 things, compliance and motivation, are true in an insurance-based care. Now, when you go to cash PT, where you get to control all those variables, and if somebody's coming to you, they're probably motivated. People don't sign up for out-of-network or cash PT if they're not motivated, because if that were the case, they probably would have been in an insurance-based PT. So you can't say they're not motivated. Now, we'll go on to the podcast, but there's a portion of that. Can you keep them motivated? That's one piece. The other one is, are they compliant? In cash PT, they want to be compliant. That's where they're coming to you. They want that motivation. They want that information. They're ready to soak it in. So if you're saying in a cash PT setting that the patient is not motivated or compliant, they came in motivated and excited to be compliant, you couldn't keep them. So that's your fault. I'm here to explain why. So there's ultimately 3 things that you need to realize on why patients leave you. And if we take out the motivation and compliance factors, let's assume they're highly motivated when they came in that initial evaluation and they're willing to be compliant. Okay, so let's assume that's the case, because that's pretty much what comes into cash PT. There's 3 big reasons why they'll leave. First and foremost, it's because you couldn't deliver on the outcome. And that's skill, right? You couldn't get the outcomes that they wanted. They wanted to be pain-free by their marathon. They wanted to have their shoulder not hurt with CrossFit. They didn't want their back to bother them in their Orange Theory class. They didn't want their shins to be hurting during their 5K. And you can't get them better. So their initial evaluation, they're highly motivated, they're compliant. You give them all the information. You probably overloaded them. They're still confused on why they're coming to see you and why they shouldn't go to insurance-based care because you couldn't provide that service. But more importantly, you couldn't give them the outcome, right? So they wanted pain-free by a month out, and you can deliver on that. That's a skill problem. That is a problem that cash PTs face early on in their business, and it's because you had a good enough skill for low pain patients, meaning they were paying a low copay. So they're kind of like Walmart, right? That they were okay paying a lower price, but now they have to pay for that same product, that same shampoo, that same bike, that same product in Walmart. They have to pay more. Now they're like, wait a minute, what's different about this shampoo? What's different about this bike? What's different about this pillow? And that's how does it make them feel? That's the outcome, right? Could it get me a better sleep? Oh, that is actually better. Your ability to provide that skill was good for insurance, but now did you have the increased skill set to deliver on that in the cash pay side? That's one problem. So if you're new in cash pay, not new as a PT, because if you've listened to my previous episodes, there are people who have 10, 20 years experience who wouldn't be able to cut it inside cash PT. Not because they don't have the skill, they have the skill for Walmart insurance-based care. They don't have it for a better experience when you're paying cash out of pocket. It's a whole different ballgame. So do you have the clinical skills as a cash PT to deliver on the outcomes of somebody who's highly motivated and highly compliant and do it at the rate that they want? That's the first one. So you couldn't get them better. Basically, if you've heard my previous episodes, there's 3 P's in business: people, product, and process. Your product is pretty poor. In any business, you have to be good at these 3 P's and hone them in. The product is the number one thing that people probably enter your world for. I hear you're really good at low backs, at knees, at hips. Can you help me with my hip before my race in a month? And you couldn't deliver on that. Of course they're going to leave you. So product, that's your skill. That's what you deliver, okay? Number 2 is you didn't let them know what was next, meaning you were a great cash PT, good clinical skill, you delivered on the product, they're fantastic, and maybe you got them there in 6 to 7 visits, and now they're feeling great. They're like, oh my goodness, my back feels fantastic. I'm now able to train and I can do my competition, or I can work out now pain-free. Perfect. But you as a provider, you don't feel good about them letting them go because you got their back pain feeling better, but they're not strong, they're not stable, they're kind of soft and flimsy, and you know that if you just worked on some strength and conditioning or some wellness care, that you can make some huge gains to help this prevent from coming back. And that customer doesn't know that, but maybe you waited till the 6th or 7th visit and you were like, hey, I'm so glad you're feeling better. However, going back to CrossFit with these, like the way you're moving and everything else, that was great to get you pain-free, but you need the next level of care, which would be my next level program. And all that would do is get you stronger, get your back even more stable, and allow you to work on mechanics so it doesn't come back. Well, that patient didn't know what you were planning to do, so now they felt great, all the expectations were met. Now you failed to deliver on what the next expectation was. So for you, you didn't tell them what was next. That was a process problem, meaning you had a fantastic idea, you were great at your product, great at your skill, you actually got them to where you wanted. In your head, you knew what the next level was for them, but you failed to communicate that. That is a process problem. That's a communication problem. You should have let them know that from the beginning. Hi, Jane, I'm going to get your back pain better. Well, you can easily get you back to CrossFit. I'm going to get you there. However, there's 2 parts to this process. The first 6 weeks, I'm going to get you pain-free. The second 6 weeks, I'm going to get you stronger and more resilient so it doesn't come back. Now, I understand you just want to get pain-free, but you have to understand, I don't want to see you under these circumstances because it's been 3, 4, 5 months of pain. I don't want you there. I'd rather keep you consistent and underneath my supervision so that way I can kind of see what you're doing inside your gym routine so I can guide you through that process and then catch you if any flare-ups happen. That's what people want to hear. So you got the outcome, but you failed to tell them what was next, and that was the process. Now, number 1, do you have the skills? Could you deliver on the outcome? Number 2, did you tell them what was next? Did you tell them the process and how things work? You probably didn't do that. Now, people blame motivation and compliance, but what if you don't have the skill? Motivation and compliance is the only thing that you know to say. And that patient's gonna be like, well, let me just check my schedule. What they're saying is, you're not good enough, and I don't know how to tell you that. And you as a clinician didn't ask why they're leaving. So you assume and blame it on somebody else except for yourself. Oh, they just weren't compliant, they weren't motivated. It's probably because you didn't have the skill. Number 2, you didn't tell them what was next. And then number 3, you didn't understand what they wanted. You didn't understand their goal. You didn't get them. You didn't understand their message. You didn't understand them as a person. And what I mean by this is, you've seen this before where maybe it was a new grad or even a colleague or maybe even yourself, and it was super cringy when you saw this happening. This patient, Bob comes in and he says, you know, my shoulder hurts every time I'm at the gym and I do shoulder press. And Bob is doing shoulder press because he's going to compete in a weightlifting competition. And he was working on getting his shoulder stronger so he can compete in the weightlifting competition. And that competition is, I don't know, 3 months out. And he was doing prep work. And you as a physical therapist or your colleague or a student comes in, figures out if it's a supraspinatus problem, it's an impingement problem, whatever the thing is, a slap, is it a labral, whatever it is. They come in getting all this fancy anatomical stuff, and they give them the same, like, you know, TheraBand or dumbbell exercises, and all they do is they focus on the 5 out of 5, pain-free, range of motion, impairments, lat length, you know, empty can, all these special tests, everything else, and they're focusing on this 5 out of 5 strength. You know what, Bob, we're just gonna get you strong, we're gonna get you strong, we're gonna get you strong. And that takes 6 to 8 weeks. Well, Bob has to compete at the 3-month mark, and you're gonna take 6 to 8 weeks to get to, you know, getting the shoulder strong. What you fail to realize is Bob still has to work out. So you're over here focused in on this shoulder, and Bob's like, well, what can I train elsewhere? Can I still work on my legs? Can I work on my overhead positioning? What can I work on? And all you're doing, and typically you'll see this, is they keep delaying that. Well, next week we'll check in. Next week, let's see how you're doing. Let's see how you're doing next week. And all they're doing is buying time because they don't forecast, they don't think forward. They're not thinking about the person and what they need to do to compete at the level that they want to. You just keep it simple. Let me just work on their impairments, and those impairments will magically make this person better. And magically, I don't know the mechanics of that thing, and I don't know strength and conditioning of that sport, so I'm gonna let Bob take care of that. But Bob doesn't know how to do that, and the physical therapist doesn't know how to do that. So who actually ends up paying the price? The consumer, the patient, because they don't get to compete. Yeah, at the 8-week, 9-week mark, Bob is now pain-free, but he's like, now I have a crunch time to compete in a month, and you didn't understand that, and now my shoulder feels better, but I don't have any way to even compete. I'm not even going to be eligible. I don't have the strength. I'm going to be so bad at this event. And what you should have done is understood and said, Bob, I don't know your sport. Let's work on your mechanics. Show me what that looks like. I can easily fix the shoulder, but at week 1, tell me what a normal progression would be like over the next 3 months. What do you do in the first month? What do you do in the next month? What do you do in the last month? Oh, you strength train. I see. So yeah, you can totally do squats and deadlifts. That's totally fine. Your overhead pressing is what we're going to hold on for the next month. We're going to slowly introduce that at the 6-week mark because we know that that's going to be, from a healing perspective, that's the perfect timeline. And by that time, we'll calm all the inflammation down. We'll be working on your mechanics so that way at the 6-week mark, when you start overhead pressing again, you haven't lost any strength in the lower body. body or your low back so you can compete successfully. By 6 weeks, now you're integrating from empty can and shoulder and dumbbell now back into weights. Now with shoulder pressing at a lower percentage, introducing overhead pressing, so that way he has 6 weeks to actually compete and know that he feels comfortable underneath the bar or underneath the weight that he needs to be at. And if you can easily get their shoulder pain better, that's easy. The 5 out of 5 MMT, the range of motion, the goniometer, that's your wheelhouse. But what you didn't get was the person and what their goal was. Ultimately, you didn't understand what the solution to their problem was. You thought the solution was pain-free, range of motion, impairments, and that'll magically allow him to compete. No, what you had to take a step back was, what was the progressions? What was the strength that was needed? What was he needing to do in his fitness and his workouts and his daily activities that would reduce the stress and allow him to prepare for the event? That customer doesn't see physical therapy as it helped. It was, yeah, it got me pain-free, but it didn't allow me to compete. The customer consumer is looking for a solution to the problem that they have, which is, I don't know if I'm going to compete in 12 weeks. You see the problem as, the impairments are causing the pain. Consumer is seeing, I need to compete. PT is seeing, I need to get this stronger and more flexible and the pain reduced. That doesn't translate to their overall problem and their solution that they need. So you have to blend a little bit of what you do on a normal basis, impairment-based treatment like insurance and PT school has taught us, with cash pay setting of help the customer see the journey of how it's going to relate. I don't play pickleball. I don't do any of that, but what I will do is understand what a 2-month training cycle of pickleball is and how their knee pain will transition back into play, how often they can go, how many hours or minutes they can play, and at the intensity that they're allowed to do. That will allow that consumer, that patient, to understand by month 1, you're not going to be playing pickleball, but you will be practicing on just standing drills. At month 2, you'll be back on the court working at about 50 to 60%. At month 3, you'll be about that 90% mark, playing at the rate that you need. That customer knows that whole process. Guess what? I didn't even talk about the impairments, because that's all the patient wants, is how quick can you get me back on the pickleball court? Not that my IT band is tight or loose or weak or whatever it is, that my calves are weak, my hips are weak, blah, blah, blah. That doesn't translate to, great, can I play pickleball? And you don't get them. That's why the consumer leaves you. And that is understanding people. That's that third P. You didn't have the product because your clinical skills weren't good enough in cash pay setting. You used insurance-based clinical care and skills to come over. That didn't translate no matter how long you've been practicing. Number 2, you didn't tell the customer what was next, and you didn't understand the process. So they self-discharged when they were weak, not stable, but pain-free. That's what they got. That's insurance-based care. Stop doing that. Third, try and solve the problem and provide a solution to the customer's real deep-rooted problem, which I'm concerned I can't play pickleball anymore. Stop focusing on the impairments, that hope that solves the problem. Understand the person and what they want. What's the thing that this pain is limiting from? Add that to your repertoire of questions. I understand your knee is hurting, Mary. What is it limiting you from doing? What's the most important thing that if this knee was pain-free that you'd love to get back to? That is understanding the person, the consumer, the patient. So underneath everything, the product is what you deliver. The process is how you deliver that. And the person and the root of understanding them is why you're delivering the care. Most physical therapists just work on what to do. What should I do with this knee? What should I do? And that's where you fail, and that's why people leave you in a cash pay setting. They won't come back to somebody who doesn't provide them value. And that's ultimately what you have to understand. When people don't want to pay for your services anymore, it's because you don't provide them value. It's not your skill wasn't good enough. That was what to do. You can have the best skill in a cash pay setting. If you don't tell people what's next and you don't understand and solve the real root to the problem and provide a solution long term, they won't stay and they will easily jump off of your schedule. And that's typically what happens with younger, newer cash pay PTs, because they're just trying to grind with more clinical skill. But that's not you, because you're listening to this podcast and ultimately you're trying to figure out, how to separate yourself and become the go-to expert inside your community. And if you find yourself stuck and you're looking for more of the solutions, you're like, Chris, I get it. I just need to learn how to implement it. What do I do in this scenario? How do you do it? And that's why I built my Cash PT clinical elevation course, ultimately to provide you with the resources of providing a better framework and a better structure and process to how you work with Cash PT patients. And the root on why you're not doing well right now, or you're not where you want to be, is not because you need to take more CEU courses. It's because you need to have a framework to how you're running your business. Or if you're working for somebody who is in Cash PT setting, it's because you don't understand. Maybe your company doesn't have a process. They don't have a framework, but you need to develop your own. And if you're just using insurance-based style, waiting for that patient to come in and you're going to work on what's next, you're being a reactive physical therapist. Just go back to insurance-based care, because that's where it does best. You need to be a proactive person who understands the patient, creates a process, and then delivers on the product. And ultimately, that's why I created my course, to give you that. And it's templates, it's scripts, it's the process, it's how to successfully manage a cash pay patient with ease, without having to guess, taking that guesswork out. And after mentoring thousands of cash PTs, I'm exploring that, and I'm now just delivering and giving those options to people who want more success. They want to, have better outcomes, not just the ones that were great in insurance-based care, but ultimately to be successful in Cash PT, develop a business, and thrive inside their local community. So if that's for you, you can go to my website at drchrisgarcia.com/elevation. And this course is scheduled for October 15th of 2024, whenever you're listening to this. And I'd love to see you inside the course. If I don't see you inside the course, I will see you guys on the next episode. Take care, guys.